Good morning, everyone. Welcome to an episode of Coffee Break with Card, La Hora del Cafecito's new sister show. Coffee Break with Card is a program dedicated to all those in our community who are living with autism, to their family members, and to all those who support them. My name is Lourdes Quinones, and I would like to welcome you to the show. So come on in, join us at the table, sign in on the comment section, and let us know if you're having a cup of coffee with us. We'd love to say hello to you. In today's program, we're going to be talking about aging, what to expect, and how to support your family members with autism as they age and as we age. So join us. We have a lot to talk about. So let's start out by introducing to you our coffee break hostesses for today. As I mentioned before, my name is Lourdes Quinones. I am a CARD consultant assigned to the primary age groups through elementary ages. Professionally, I am a pediatric physical therapist as well as a special education teacher. I am joined by Jasmine Castellano, who is an excellent professional in the field of mental health, is a CARD consultant assigned to the middle and high school ages, and is a mother of three, one of whom is diagnosed with autism. Welcome, Jasmine.
Thank you, Lourdes. Good morning, everyone.
Olivia McDonald is an excellent professional in the field of public health, is a CARD consultant assigned to the primary age group, just like me, and is the mother of a beautiful baby boy. And he's about, what, 4 months, 4.5 now? And then she has a younger brother diagnosed with autism. Welcome, Olivia.
Good morning. Thank you.
Miguel Dana is an excellent special education teacher and is the chair of CARD's Constituency Board, and is the mother of three children, two of whom are diagnosed with autism. Welcome, Maggie.
Thank you, Lourdes.
Ima Camposano cannot be here with us today. She has a previous engagement, but she'll be back next week. See you soon, Sima. Ima, have a great weekend. And before we get started, let's review the rules by which we want to adhere during this programming. Remember to keep an open mind, maintain a positive attitude, and use respectful language. This will ensure that we have a safe environment for all of us. So before we get started, Jasmine, is there someone we want to say hello to? Any comments?
And we don't have right now, not that I can see.
Perfect. All righty. So as you come in, be sure to sign in. As I mentioned earlier, we're going to be talking about aging and what to expect and how to support your family members with autism as they age. So join us. We have a lot to talk about. So let's get started.
So, Yasmin, I had a question. So, how can parents or caregivers prepare for the aging of their loved one with autism?
Well, Olivia, first of all, it is important to accept that the diagnosis of autism, it is for life. It's not something that will stop or will disappear when they become adults. And, I know that we focus a lot of kids and children and young adults. And for whatever reason, behind our head, it's like, no, an old person and a senior with autism is like, we don't think about that. So it is a diagnosis that is for life. We have to accept and identify the limitations as well as the strength of that person with autism. We need to meet the individual needs of the person with autism. We have to appreciate their potential and the contribution to the society that they have done. It's something that we have to respect, not only for people with autism. I think any senior, it is something like us as younger people than they are. We should appreciate their potential and their contributions to society and listen to them and learn from them. Usually is the other way around. We think like, oh no, I know more than you do because I'm faster or whatever. And identify different resources and strategies for elderly people with autism. So that will be the first step that we need to have in consideration.
That's really helpful to hear, Jasmine. And how can parents and caregivers assist their loved ones with autism as they age?
Well, First of all, it is important to be prepared for the loss of skills and abilities as the person with autism becomes older. So we need to think that, and remember, like in my case, and probably Maggie, in your case, we are hope that we are not the ones in the position, of taking care of our kids when they get senior, because we won't be here, no, because we're going to get older, and we are a little bit older than they are, so we're going to be gone by that time. But just to prepare, if they have siblings or anyone who's going to be taking care of our little ones and little ones now with autism when they grow older, just to make sure that they are aware of these techniques or strategies for them to be able to provide the proper care. So just to remember that, they're going to have lots of skills and abilities as the person becomes older. It is important to provide reassurance to your loved ones with autism, and it's important to let them know that it is completely natural to lose some skills. For example, like hearing, vision, balance, flexibility. Just remind them of that. It's important to be extremely patient and give the person with autism the time to communicate at their own pace. It's important that that patience and that communication is in both ways, for them to express themselves and for them to listen, process, and understand the information that we are giving them. So it goes both ways. We have to remember that communication is one of the challenges that our loved one with autism sometimes they face. It is important to remember that when they misbehave, no, we know that people as they get older, they're like sometimes like little kids, and if they're not supposed to eat chocolates, they can sneak a candy bar somewhere and kind of eat it without no one noticing it. Like, you cannot do that, you know so just remember, when they misbehave, uh, it's not always intentional, no. It is important to know that your loved one with autism very well, and be able to make the difference between when they are doing things intentionally, like little kids trying to sneak around things and let me see how far can I get away with it, or it's just unintentional. It's part of their autism or sensory challenges that they can have. And also have suggestions and or solutions ready in case of any misunderstanding or problems. Provide different choices. Allow them to express if they agree or disagree with those choices or solutions. Ask them, what would you suggest we can do? Okay, and try to maintain an open communication with your loved one with autism, and that's very, very important.
I Yeah, I do have another question, but I to that to point that you brought up earlier, Yasmin, about that, um, if you're if you are alive and taking care of your child, that you're probably going to be older, and so that's also when you're talking about having kind of like an idea or solutions ready in case. I think that's one of the things too to think about is you're gonna maybe need some backup of your own.
Yes, and that is true. That is correct. We need to have a backup for ourselves. Like, for example, I have two other kids, but if by any chance my daughter with autism were the only one, then definitely, and regardless, we need to have a backup. Not only for myself but also for her, and sometimes us as a parents, because we are so involved in like caretaking of my child, we don't think that I'm not going to be here when he, or in my case, when she grows older. I'm not going to be here when she's 65.
Well, we don't know that, but that
Well, we
could
don't know.
happen.
I'm saying that I'm going to go at least to 103. So maybe
Yeah,
I'll be here. But but I won't be able to take care of her.
You'll
exactly.
need
But even
backup. You'll need backup.
yeah, even if you are around, right, you might be needing services yourself. So you have to keep
Exactly.
that in mind. And that is why we're having this conversation. And that's why in the past, we also, Olivia brought us a lot of information. And if you haven't seen this episode about guardianship, we invite you to go to our YouTube channel and
Mhm.
find cardusf and then go in the playlist and find
On
Coffee
guardian
Break with
advocacy.
Card. Yeah. And so there was a recent episode that we did talking about guardianship. So having those things in place. And next week, we're going to be talking about special needs trust, setting up those little things that are going to be plans that will be in place in case that you are not around or are not physically or mentally able to carry on those responsibilities. Who's going to be taking care of your loved one with autism as they age as well, and what things are in place, in terms of where is he or she going to live, etc. And this is why we're having this conversation. So we hope that is very useful to you.
Yeah. So the other question I had was, what are some of the challenges faced by an elderly person with autism?
So some of the challenges, Olivia, are, for example, social isolation, loneliness, and not only for elderly with autism. I mean, in general, our seniors and elderly people, they tend to be alone, lonely, feel lonely, and social isolation. But it gets, how will I say, it is a little bit worse with our loved one with autism, because that's one of the challenges that our people with autism, since they are little ones, they face the social withdrawal. They don't, lack of social skills. They don't spend too much time with friends or with peers and all that. So that's one of the challenges. Low life expectancy is another challenge. I remember that autism doesn't come by itself. It's not our only diagnosis. It comes with other diagnoses as well. So that's another challenge. Financial difficulty or the need for financial support. That's another challenge, not only for our loved one with autism, but again, across board, most of our seniors, unfortunately, they are facing a lot of financial challenges. And but our people with autism, since the beginning, in terms of as young adults trying to get a job, a decent job, a good career with a decent salary, most of them live in poverty levels and severe poverty. And how are they going to build that financial support for their retirement or the senior years when they can barely make it, in their 20s, 30s, and 40s? So it is difficult for them to adjust to sudden changes, like, for example, illnesses, the loss of loved ones, grief. Those are things that are going to be happening in their life, and sometimes, kind of fast. Sometimes you have the love of a good friend, and from there, 2 months later, you have a loved one who passes away, and it's like, when it comes all together at the same time, and it's kind of hard for them, like for everyone, anyone, to cope with all those changes. And they are at a high risk of suffering from schizophrenia, Parkinson's, anxiety, and depression. We know anxiety and depression, since they are kids, that's one of the
Comorbidities.
mental health, exactly, mental health conditions, comorbidities that our people with autism can suffer, and it can get worse during their senior years, and schizophrenia and Parkinson as well.
Yeah. And so I'm so glad that you were talking about this situations, because I actually had a family that one of my ex patients, and I say ex only because I'm not working as a physical therapist right now, and she lost both parents, one right after the other, right now during COVID. and she does have intellectual disabilities, and they were gone from one day to the next. So with our loved ones with autism, we know that they're stricklers from routine, and so all of a sudden it's like, how come mom is not here or dad is not
Mhm.
here? What's happening? And to be able to process all that information at once. So those are things that are very important for us to keep in mind that could happen, and how do we prepare them, and how do we prepare their life to, in the case that that were to happen.
Correct. Correct.
And how can health professionals assist an elderly person with autism?
So, Maggie, that is a very important question because most likely health professionals will be the ones taking care of our loved one with autism, because we're not going to be here, most likely. And what if they have siblings? What if their siblings are unable to take care of the person, with autism, because they're going to be growing older too? I mean, they're not going to be. My son is not going to be 23 for the rest of his life. He's going to, but he's going to be the oldest. So maybe my daughter is going to be 65. My oldest son is going to be almost 70. But so so it is important to provide or connect that uh, person, the elderly, with support groups. Or maybe if they are in a nursing home, uh, maybe the nursing home can have, or we can suggest for them to create a support group for them. Like older people with autism have similar challenges and needs. For example, loneliness, social disconnection are the areas that require great attention. We can contact local organizations to research for services that are available for elderly people with autism. So those are the things that we can do. Or like I said, at the same nursing home, they can have a group home, and that will help with that loneliness and social isolation, because it is part of their routine. Like, okay, you need to take your meds, you have to eat, you have to brush your teeth, you have to go to your support group. So if we put it like part of the routine, it will help. It is important to use explicit language when communicating with people with autism. Being part of the autism spectrum can affect communication skills. So it is important for the healthcare staff to be very specific when they are communicating with a person with autism. For example, instead of asking, "How are you?" they can ask, "Are you tired today?" Or, "Do you have a pain here?" and point to the specific area. Like, do you have a headache? Is your arm hurting? Your leg? And try to point at the area of the body. So be as specific as possible. uh, because older people with autism, they have greater difficulty expressing their needs and problems. It is important for the staff and the caregiver to observe changes in their behaviors. For example, do you notice if the person is more isolated than usual? Do you notice that the person is limping or showing some sign of pain that is not there before as part of their baseline? If they before they were more receptive, now they are not receptive out of the blue moon. So how come there's a change in that behavior? Where is this coming from? Okay. Or out of the blue moon, he or she is crying for anything. And look, how beautiful is the day outside. It's so sunny, and they start crying. How? Why? Instead of brushing it off. It is important to provide a specialized staff. For example, provide the medical and emotional support. And I'm going again, not only the medical support, but also the emotional support is very important, uh, who can assist in developing the treatment and protocols to address the needs of someone with autism, like the cardiologist, neurologist, the GI doctor, the therapist. Sometimes they need physical therapy, occupational therapy. It is important that mental health therapy. It is important for everyone to have an open communication, and the caregivers or the family members to be involved in the care of that person with autism. You cannot just put that person in a nursing home. Oh, that's what I'm paying for. They need to take care of him or her. No, you need to be involved with all of them, with all the people that are working in the care of your loved ones. That is very, very important. And remember that you are the one who's leading. It's not the doctor, it's not the nursing home. And provide a structure and routine. This is extremely important from the beginning, and we have addressed this with our little ones in different past shows that we had about the structure, the routine, creating visuals and all that. Well, when they grow older, there's no difference. They need that structure, they need that routine. Maybe they might need visuals as well, in order to follow the directions and being able to fulfill the expectations. So that's also important to have it in place. And be thoughtful regarding the sensitivity of the person with autism. We know that some of our people with autism, they have sensory issues, and that's one of the challenges. And probably when he was a young adult and he was in his 40s or 50s, he had no issues with loud noises and everything was perfectly fine. But now that he's 65 or 70, he has some challenges with loud noises. Why? Because we change, our body is changing, and there's no difference with them. The same thing that, like, I was saying, when I was in my 20s and my 30s, there was no way on earth I will eat a vegetable because I didn't like them. And now I am eating them and I like them. Why? I guess because my sensory in terms of of my mouth and flavors and all that, it changed. So for the good. So there's no difference. They also, our body's changing, their body is changing.
And it's so right, because right now I even noticed that after 18 months of being isolated, I have my auditory field is so sensitive that I get bothered by too much noise outside my door, by too much noise of people talking and whatever. I'm like, just, even in the car. It's like not even bringing the windows down. It bothers my ears to hear that, or have the radio. I just need total silence. So being in that bubble has made me more sensitive in my ears. So that could also be part of that. So I'm so glad that we're talking about this subject, because it is a subject that doesn't come up very often. It's something that is natural. It's something that is happening, and it will happen, but you don't hear very much about it. At least I haven't come across very many talks about it, or interviews about it, and this is why we're bringing it. So thank you for bringing that information to us. I wanted to ask you, do you have anything else you wanted to share with our audience?
Yes, I'm going to be posting some resources, like from the Florida Department of Health, Autism Society of Florida, the Dan Marino Foundation, and the APD, as well as our CARD USF website. You can always call us, and we will be more than glad and happy to assist you and connect you with different programs that can help you in implementing a plan for your loved one with autism as they grow older, or for their elderly ages.
Yeah. And so thank you for doing that. And again, we have episodes in Spanish. Sometimes some of them were in bilingual. Uh, we have created this program, separated it from the sister program, La Hora del Cafecito, so that it could be all packaged in one language. But we do have resources that we have done in the past regarding special needs trusts, coming again next week. We're talking about that subject. Also, we've done guardianship. We've also talked about different things and resources in the community. So be sure to check those. And also, for those of you who are watching me, if you have anything that you want us to talk about, any ideas, any comments, any questions, be sure to put them comment sections, and we will be sure to answer you through the web, through the comment sections, or maybe through a future episode. You know that we always say if we get an idea from your questions or from your comments, we'll be sure to give you credit for giving us that idea. So I hope this conversation starts a new conversation that we can all start sharing about, and maybe there's some something that you want to talk about and hear about that can help guide our programming. Okay, so be sure to do that. But anyway, talking about that, do we have any comments or questions at this time?
No, no, not at this time. We do not have any comments at the moment.
Perfect. Okay. So what we're gonna, again, if you're watching this after we go off the air and you have questions or comments, just be sure to leave them. We'll get back to you. We'll monitor those, and we're always answering them. And
Mhm.
anyway, so that brings us to almost the end of the show. But before we go, I wanted to first of all give Jasmine a very deep thanks for you for bringing us this such important information, and for giving us the idea of doing this show. So thank you for all the work that you did to bring the information to our audience. We appreciate it. Also wanted to remind you that next week at Coffee Break with Card, we're going to be talking with our a representative from the Family Network on Disabilities, Stephanie Porro, who's going to be bringing us information about special needs trust. Stephanie is a lawyer with FND, and this is her area of specialty. So she's going to bring us a lot of information. So if you have any questions you want us to ask her, be sure to leave them on the comment section, and we'll be sure to ask those. But also don't forget to tune in next week. We're usually coming in the air anytime after we get off from La Hora del Cafecito, which is could be 10:30-ish all the way to 10:45, but we'll be in that kind of window just as long as we have to finish up on that show and then come back on this side to do the English version of it. So be sure to stick with us, save that on your calendar, and then come back. If you don't have time, you're working or something like that, come back to watch the recording. Okay, we appreciate it. Anyway, so finally, before we go, I really wanted to ask you for a little favor, and is that we want to, if you could please go in the link that we're going to be putting down in the comment section to evaluate us. Let us know. It's a survey, it takes less than 60 seconds. Even if you've done it in the past, every time we go in the air, we ask that you please give us your opinion. Let us know how we're doing. If this information that we're bringing you is important to you, this is the way that we can justify the time that it takes us to gather this information together so we can bring it to you, as well as the time that it takes us to be on the air with you. So please, thank you for doing that. Anyway, so this definitely brings us to the end of the show. So before we go, we want to remind you to please give us a like, share our page with on your page, and with all those who you know will benefit from this kind of information. And be sure to meet us next week here to hear us talk about special needs trust, and always here so that you can hear us spill the beans on important topics related to autism. Okay. But until then, we want to wish you good vibes and good coffee. Thank you so much. We'll see you next week. Have a wonderful weekend.
Bye.